So what are we doing different in Jaramogi as a tertiary facility that serves as a referral center for the 4 high-burden counties in the western region? So we have advanced red cell exchange transfusion, and the aim of this was to strengthen care for severe complications. So one of the most devastating complications of sickle cell disease is acute stroke. We saw most of our patients coming in with stroke. And the other complication that we saw was chronic complications, especially for the adolescents and young adults that have lived with this disease. So most of them will come in with repeated painful crises, making them unable to go to school or work, repeated episodes of anemia requiring frequent transfusions, and the facility acquired a machine, the Optia Spectra, which has helped us to be able to give quality care to these patients to improve the quality of life. Jotiaret is the first public hospital conducting red exchange transfusion, and the first procedure was done on the 1st of September 2025. So that was our patient 001, and up to now, for the last 11 months, we have done 11 procedures in the facility. So this procedure is fully covered by SHA, and our patients are able to access 3 exchange transfusions in a year, which is adequate enough for our chronic transfusion programs. So what can we do? What we can do is to make sickle cell a healthcare priority. So the early diagnosis for every child, every crisis should be managed promptly, every family educated on sickle cell, every clinician trained to pick up these complications in time, and to strengthen our system to bring us closer to a future where sickle cell disease will no longer mean despair to these patients, but hope for living a healthy life without disability. Thank you.
Thank you very much, Dr. Misore, for that success story. There are things that we can do, and there are many other hospitals that need to give the same services to our client. Your Excellency, our next stage is to have lived experiences from a maternal saved, a mother saved, a newborn saved, a sickle cell case, and 2 of our facilities. So I'll ask Dr. Juliet to give me the names, to call them here. They will be standing here and give their lived experience. Each will be 2, maximum 3 minutes. Thank you.
Your Excellency, the First Lady of the Republic of Kenya, Honorable CS Aden Duale, CS for Health, and all protocols observed, allow me to moderate and lead this team of Iwene Blooms. This is a group that is selling courage, hope, and showing that we can actually save our mothers and newborns while we are doing everything we do in our everyday life. Allow me to call on stage Elizabeth Nabita, who's an RH coordinator from Kisii County. Welcome, Elizabeth. Dr. Felicitas Makoha, neonatologist and county pediatrician in Bungoma County, who will come and share the story of the 770-gram ray of hope. Next on stage will be Dr. Sura from Pumwani Maternity Hospital, an obstetric and gynecologist. Kindly welcome on stage to share your story. Next will be Nancy Kerubo Onchenku, who will share a lived experience as a mother saved, baby saved, and SHA did not fail her. Last on the list, but not least, is Tracy Acheng, who's a courageous speaker. I'll start with the one by one. This is the Iwene quickfire. 2 minutes, share your experience, then we'll continue the session.
Your Excellency, good morning. I am Elizabeth Nyabicha from Kisii County. Today, Kisii County is doing 62 days of 0 maternal deaths. What does this mean? Commitment and teamwork. So I salute the Kisii County leadership, the healthcare providers, and the partners supporting in maternal newborn health. In the spirit of Iwene, Kisii County leadership prioritized maternal newborn health services, and among the activities that Kisii County is doing is MPDSR accountability, whereby every week we sit and ask ourselves, why did mothers die and what can we do differently so that a mother does not die? So among the gaps that we identified falls among the pillars of awareness. The first gap was the breakdown in critical care services, where we had a breakdown in our ICU, breakdown in oxygen supply in our Kisii teaching and referral hospitals, and our leadership came quickly and repaired the oxygen plant, and we had the ICU equipment being replaced first. And the other gap was the gap of quality care, whereby we trained 32 healthcare providers in the month of June, and these healthcare providers added to the pool of mentors who were trained earlier, and they do weekly drills, weekly CMEs, and continuous mentorship, and this builds confidence to the healthcare providers so that they are able to manage emergencies that come. The other gap is on referral, whereby in every review we had a gap of delayed referral being mentioned, and so the referral unit was tasked with the responsibility of accounting for every referred mother, every referred newborn, and they were able to give outcomes. We cannot be able to leave out the community component, where we have our CHPs referring our mothers from the community, and they do continuous follow-up to identify danger signs. Lastly, Kisii County has adopted the digital platform, whereby we promote our mothers with messages so that they are able to be promoted during pregnancy and postpartum period. So our call for action as Kisii County is to sustain the 0 maternal deaths. If you are doing day 62, then we can do day 70, day 90, day 180, and at the end of it, day 365, whereby we'll have all our mothers alive, home with their babies to thrive. Thank you.
Thank you so much, Kisii County. We'll now welcome Dr. Felicitas to share her story.
Thank you, Dr. Juliet. My name is Dr. Felicitas. I'm a pediatrician with specialty training in newborn care. Today I'm here to share a story of hope of a baby who, because of the physiologic weight loss, the weight dropped to 500 grams, but because of the interventions that the ministry has put in place, supplying CPAP machines, subsidizing the cost of caffeine citrate that we use to prevent apnea of prematurity, and having comprehensive newborn care training, the team in Bungoma County Referral, headed by the neonatologist, myself, pediatrician and neonatal nurses, were able to take care of baby fever until discharge when the baby was 2 kilos. So, previously, such babies will be termed to be an abortion or a miscarriage. But because of the interventions that the ministry and the county governments have put in place, we have a lot of success stories of babies who are born extremely preterm, less than 1 kilo, surviving. What are the key issues that you have to put in place for these babies to survive? They have to be born in the right place. So our CHPs who are here, if you have a high-risk mother, make sure that she goes to the county referral hospital, where she'll have access to these services for the baby to be able to survive. Let this baby not be born at a lower level facility and be transported cold to the facility, and by the time they reach there, they die. So I'm here to provide hope for families that have had babies lost at an extreme gestation, that now we have facilities in place to reduce deaths attributed to prematurity, which is the leading cause of newborn deaths. Thank you very much.
Thank you so much. I'll now welcome Dr. Sura from the largest maternal hospital in sub-Saharan Africa. Welcome.
Hi, good morning, everybody. Thank you for this opportunity to share on how Pumwani Maternity Hospital continues to lead the way in quality maternal and newborn health. As Dr. Juliet mentioned, we're the largest maternity in Kenya and sub-Saharan Africa. We do about 15,000 to 18,000 deliveries per annum, and that's looking at about 50 deliveries per day. We may have dropped a few in the last 2 years due to some industrial actions. But essentially, in the last 19 months, that is about 1.5 years, we've reported nearly near zero maternal deaths. This is not an accident. This is a deliberate effort in sustained investment in our leadership and workforce. Ewene is a framework of 10 pillars, and we really try to incorporate that in our care at the hospital. For example, when we talk about the workforce, almost to date, 95% of our workforce, that is nurses, midwives, and medical officers, have been trained in EMONC, that is the Emergency Obstetric and Neonatal Care, comprehensive newborn care, and even a relevant amount of workforce has been trained on point-of-care ultrasound at the bedside. So that means at any given shift, we have a specialized workforce taking care of patients. When we talk of Pumwani, we talk of not working in isolation, partnerships with our referral hospitals. We don't have the ability for an ICU right now, but we talk of partnerships with our sister hospitals and ability to access ICU care. So when we are unable to escalate care, we're able to refer in a timely fashion. We talk of respectful maternal care. That is one of the core pillars that we hold true to our hearts at Pumwani. No mother should suffer with no dignity. Partnerships, we're a hub of research. We partner with foundations and donors. We're able to now allow that to bring in technology and offer, for example, continuous CTG monitoring for all our mothers. And we've taken it a step further where this is AI enabled. We're also able to do preventive, early detection and treatment of postpartum hemorrhage, one of the biggest killers of our mothers. What more can I say? Pumwani is known by its volumes, but we're distinguished by our outcomes, and that's the Pumwani way. Thank you.
Thank you so much. Your Excellency will now change gears to lived experience. We have a mother who was saved, a baby who was saved. And here she is, Nancy Kerubo, to share her story. Welcome.
Thank you. All protocol observed. Hamjambo. My name is Nancy Oncheku. I'm here to present preterm moms. Ningeongea kwa Kiswahili ndio tuelewane na wamama wenzangu ambao wako nje. Nashukuru sana. My journey started nikiwa na 30 weeks wakati maji ilipasuka nikiwa kwa nyumba. Nikakimbia hospitali Mbagathi. Kufika Mbagathi nikapokelewa vizuri, nikadungwa shindano za kusupport lung development ili waendelee kuniobserve mpaka wakati wa kujifungua ulipofika. Hila huwa wakati wa hukufika. Mtoto wangu alikuja mapema na 31 weeks. Nilikuwa nimetense sana kwa sababu kweli wamama ambao mko hapa mnaelewa kweli mtoto wa 31 weeks ni mdogo sana. She was so tiny. I was tense like mtoto wangu kweli hata survive, lakini kweli alisurvive, hata mnamuona hapa, si ni ukweli? Nashukuru Mungu kwa sababu wakati alipozaliwa alipelekwa nursery A, akakaa 2 weeks Mbagathi, madaktari wakamshughulikia vizuri. Ilipofika after 2 weeks akawa na shida ya kupumua, akapelekwa ICU. Mtoto akakaa pale 2 weeks pia, nikawa nimetense, najua bili imeenda juu, nitalipa vipi, nikawa nimechanganyikiwa. Mungu ni mwema, madaktari walikuwa pale ni wazuri sana, walishughulikia mtoto wangu vizuri na nikatoka hata nikaenda side nyingine ya kangaroo. Mtoto alitoka akiwa na 1.4 grams, nikienda kangaroo alikuwa na 1.6. Pale kangaroo ni mahali unaweka mtoto kwa tumbo akiwa vile amezaliwa, ili you bond with her na apate ile joto ya mzazi kana kwamba bado wako kwa tumbo. Tulikaa pale siku kadhaa tukatoka. Tulipotoka pale hospitalini mtoto alikuwa na 1.9 kgs. Mnasemaje? The doctors, the nurses are doing good work. Jangamoto ni kwa SHA. Wamama wengi hatuna SHA. Mimi nilipotoka nilikuwa na wasiwasi, nitalipa aje bill. It was more than 600,000. Ajabu ni kwamba nilipoenda kuuliza SHA niliambiwa my bill has been cleared. Si kulipa hata senti moja. Wamama, ambao tuko pale nje, mnaonitazama, jipangeni vizuri. SHA ni inalipa vizuri, SHA inapokea wamama vizuri. Ukiwa na SHA usiwe na wasiwasi. Changamoto nyingine, mtoto akija mapema usiwe na wasiwasi, mtoto wako ataokolewa akiwa hospitalini, ataweka nasari, apate matibabu mazuri na atatoka akiwa mzima. Asanteni.
Asante sana, Nancy, for sharing your story. Next, I'd like to invite Your Excellency. We are aware that you're the global newborn screening advocate for our country. And Tracy, who's coming on board, will come and share her story of survival, courage, and resilience. Welcome, Tracy.
Thank you so much. All protocols observed. My name is Tracy Achieng. I'm 32 years old, and I have sickle cell disease. I'm here to tell you about a condition that I was born with. It means that it was a condition that back then nobody knew. So it is a very debilitating condition, meaning that we go through a lot of pain. But despite that, I am here, and I am here because of the support of my country. I recently, on 6th of August, went through blood exchange, which was supported by SHA. SHA ililipia hii mwili yenye mnaona. I was not like this before. So, and it is not just my body. There are other sickle cell warriors, such as Michelle Omulo. You saw her picture. There's Lindsay Berita and many others. So I would really say that we are grateful. Apart from that, I would also want to highlight that as sickle cell warriors, we need more support, especially when it comes to our vaccines. This is not just a luxury for us, because this will prevent us from going to hospital, because prevention is cheaper than admission. And even in my story, there's somebody that I cannot miss to highlight. There is Mama Dafala, the Kenya Blood Ambassador. Mama wa Taifa, I would like to just let you know our experience as sickle cell warriors while we get our blood exchange. I have to keep making calls. Unaweza nisaidia damu? Hapana. CS, unaweza nisaidia? I have to do this until I get 10 pints. That's not easy. If you've done sales, you understand. So Mama Dafala adopted me as a patient, and she's a Kenya Blood Ambassador. I would please ask the government to work with such ladies who have goodwill, or persons with goodwill who want to help sickle cell warriors, especially when it comes to blood, because blood is finite. And looking at my background in law, I would love to highlight that Kenya has the best policies. And one of the policies I would like to highlight is the newborn screening. I would like to sensitize and say that let us continue to implement it all round, because every implementation that is delayed has a name behind it. For example, we have Joe Mudukiza. He recently passed away. Joe was a well-known sickle cell warrior and advocate. He started the journey back in 2016 with Honorable Isaac Mwaura. And what Joe's journey brought forward is the need for mental health support, because unfortunately at some point he really wanted to go to Berlin to get euthanized. So I would like to say, as sickle cell warriors, we are really celebrated because of our, bravery, but we never really ask what is the cost that we pay to be brave like this. Let us get our psychosocial and mental health support. Asanteni sana. And I would also love to say that I would want to work for my country. In October, I'm going to the International Sickle Cell Anemia and Thalassemia Conference in London. And I would like to say and show them that SHA is working. SHA has universal health coverage. So mukinishika mikono, I will be very happy to show this. And asanteni sana CHPs, Embakasi Central Unit. My mother is one of you, Nyamavila. CHPs, you're the ones who can help us to implement this thing of newborn screenings, because you get into homes, you can say and tell, this home has people who probably have the condition, and any hospitali get the screening. Asanteni sana for holding my hand. Let us hold the hand of thousands more. Thank you.
A round of applause. Your Excellency, the First Lady, dignitaries in the room, maternal and newborn health champions, we have had stories. In every woman, every newborn, everywhere, we always face the sun. There are challenges, but let's also amplify the positive stories to encourage one mother and any newborn who cannot speak for themselves. Kindly let's give a last round of applause to our panelists as they leave the stage. Thank you.
Thank you very much, Dr. Juliet, for ably moderating that. You want to take a photo? Please come back. Thank you. Your Excellency, I also want to recognize our governors. Please join the photo. The governors in the House.
Yes.
Yes.
I can leave my things here.
Yes. Thank you very much, Your Excellency, for that good gesture of warm motherly care. It's a milestone for these warriors to achieve this today. Asante sana. Next we have it's my honor now, Your Excellency, to call upon our Director General to take the program from here. The Eweno Promise, turning commitments into lives saved. Karibu DG.
Thank you, Dr. Bashir. Your Excellency, the First Lady of the Republic, Mama Rachel Ruto, Cabinet Secretary for Health, on Aden Duale, Excellency Governors present, CEOs of our hospitals, senior officials from the ministry, our PSS, distinguished delegates, ladies and gentlemen, good morning. Your Excellency, I will take us through a few slides as to why the global community came with this every woman, every newborn, everywhere slogan. The reason was that progress towards ending preventable maternal and newborn deaths had stalled, and resources were now being channeled elsewhere. And what was the reason for this stall in progress? Basically, 5 things contributed to the slowness in terms of progress of accelerating reduction in preventable maternal and newborn deaths. One was the disruption caused by COVID-19. Both the non-medical countermeasures we put in place disrupted services. Number 2 was because of conflict. You saw in the earlier video that 70% of the maternal and newborn deaths happen in sub-Saharan Africa. And globally, the figure is actually 260,000 maternal deaths. 70% to 80% of that happens in sub-Saharan Africa. So conflict was a key driver in stalling the progress. Number 3 was climate crisis, either because we have floods and we have disruption in health facilities, or we have droughts and we have food insecurity, acute malnutrition follows, and definitely, usually the first people who get affected are pregnant mothers and children under 5 years of age. The 4th C is because of aid cuts. Cuts in overseas development assistance really disrupted services in especially low middle income countries. You saw the stop work order that was issued by the US government and how that disrupted health service delivery. And the fifth one, which we are all being accused of, is called complacency. We'll let the ball drop. And therefore, WHO, UNICEF, UNFPA came together to be able to galvanize the global community to shape the direction going forward. Next slide. So in terms of progress, this is where leadership, where the rubber meets the road. His Excellency the President took it upon himself and asked very important questions. Why should mothers and children die? Yet we have the technologies, we have the expertise, we have the resources to be able to prevent maternal and newborn deaths. And the way to be able to do this for us as a country is we went through a process, developed a process of our plan for Awena 2026-2028, and we decided to be able to focus on the counties that were underperforming. This is a total of 26 counties, and that is critical because that is where you can be able to quickly change the indicators. Countries which are doing well will continue to receive our support so that as a country we move forward together in the spirit of universal health coverage, ensuring that nobody is left behind. A child born in Lokichar in Turkana should have the same chance to be able to live and thrive like that one born in Nairobi or Lungalunga in Kwale County. So we came up with targets of the 90, so that 90% of our mothers can be able to attend at least 4 antenatal clinics, and 90% of the births ought to take place in a health facility. Your Excellency, in the first 90, we are on track, though we need to do a little bit of more work to be able to push. We are 72%, to be able to push that to 90%. In the second 90 of skilled birth attendants, nearly 9 out of 10 mothers in Kenya now deliver in a health facility. And that is covered by SHA. And therefore, one of the critical gaps that used to be there, which was financial access to healthcare services, has been removed by the directive of His Excellency the President to ensure that we allocate resources under the Primary Healthcare Fund to be able to support deliveries at level 2, level 3, and select level 4 services. What now we need to do, Your Excellency, is to be able to ensure that of the 9 out of 10 who deliver in a facility, they receive quality and respectful care, so that we can be able to inspire all mothers to deliver in health facilities. Further, His Excellency the President committed to be able to support this Awena cause by allocating the requisite resources to ensure that the progress that we have made is sustained and consolidated. One was allocation for money to be able to procure critical health products and technologies, which have been spoken to by the experts from Pumwani and Bungoma, like caffeine citrate, magnesium sulfate, heat stable carbetocin, to reduce the known causes of maternal and newborn deaths. The President further committed to allocate more resources for family planning, as you were told during our visit to the exhibition booth, that investing in family planning can actually be able to reduce maternal mortality by up to 40%. And then we also, HE also made a commitment to be able to recruit 5,000 extra healthcare workers, nurses and midwives, who will mainly serve at the primary healthcare facilities. And we want to be able to invest more in primary healthcare facilities, because investment in PHC facilities promotes inclusivity, equity, and mothers and children are the greatest users of primary healthcare services. Therefore, as a country, the leadership has spoken, the healthcare workers are seized, and you have heard testimonials from Kisii to Bungoma to Pumwani, what the healthcare workers are doing to be able to change this narrative. As a people, what we now need to commit to is to be able to optimize our resources that we have, make the right investments for the greatest impact. We will continue to shine the spotlight on the counties that are off track, because focusing on them, we will be able to ensure that we can be able to have a rapid reduction in preventable maternal and newborn deaths. And Your Excellency, these counties are mainly in the northern arid lands, the coastal belt, and in the lake region because of the problem of malaria, HIV, and poverty. We need to be able to maintain focus on subnational level so that as a country we move forward as one people, so that no one is left behind, and quality of care becomes very, very imperative in this process so that mothers can be able to receive quality and respectful care when they go for services. And finally, at the very end, families, communities, and one whole people must be at the center of this in terms of the plans we make, in terms of the policies we make, in terms of our implementation framework and accountability. The counties have seized this moment to be able to put in place critical accountability measures, including maternal perinatal death surveillance and response. And now that has been institutionalized literally across the 47 counties. And that is why you can be able to get reports of Kisii going for more than 2 months without a maternal death, Pumwani delivering more than 15,000 mothers without a maternal death. Your Excellency, we want to thank you most sincerely for adding your voice to this very worthy and noble cause to ensure that we end preventable maternal and newborn deaths. We have the tools, we have the expertise, and together, if we walk this journey, we should be able to make a difference before the 2030 SDG targets. With those few reflections, it's now my honor and pleasure to invite the peers to make the remarks and take over the rest of the program. Thank you.
Your Excellency, the First Lady of the Republic of Kenya, Honorable Cabinet Secretary Aden Duale, Excellency Governors, UN agencies here represented by WHO and all our other partners, county government staff, CECs, chief officers, all the Ministry of Health directors, CHPs, habari zenyu, na all our distinguished guests of this summit. Your Excellency, we want to appreciate you for taking a lead role in championing Ewene together with His Excellency the President. Your Excellency, much has been said, and so I just want to mention that from an implementation perspective, we are also coordinating all hospitals at the county level and at the national level to ensure that the targets that the Director General have already placed before you are being implemented. We've had a number of meetings with chief officers of county governments so that we ensure that their hospitals are moving to ensure that even when we have the commodities at KEMSA, that they are ordering for them, but more importantly, that they are also training healthcare workers to be able to put all the machines and the products to use, as you have seen from Kisii, from Bungoma, from Pumwani, and from the beneficiaries. Your Excellency, I just like to recognize my colleague, PS, Madam Mary Mudhoni, just to stand and wave in the interest of time. And then with those remarks, I will invite Excellency Honorable Sakaja to give his remarks, recognize the other governors, and then we'll invite CS Duale.
Your Excellency, Mama wa Taifa mpendwa Rachel Ruto, Waziri Duale, makatibu, magavana wenzangu, leo tuko na gavana wa Nandi, Mheshimiwa Sang. Tafadhali tumpokee hapa Nairobi. Tuko na gavana wa Mombasa, ndugu yangu Abdul Somad, ambaye ndio mwenyekiti wa afya. He's the chair of health at the COG and is doing a good job. Na pia tuko na Governor Mudhomi Njuki ambaye ni vice chair wa COG. And Your Excellency, I must say that a lot of the heavy lifting that was done when we were doing the health sector reforms from 2022 was spearheaded by Governor Mudomi. He was the then chair of health at the COG. Him and Governor Waiguru did a lot of work. And so the rest of us now, the chair of health etc., are carrying on based on what Mudomi did, and we really appreciate what you did. Your Excellency, distinguished guests, our CHPs, CHPs oye! Habari ya leo? Mko salama? Your Excellency, every woman, every newborn, everywhere has given Kenya a number that none of us in leadership can afford to look away from. Even as we celebrate the successes, every day we lose approximately 15 mothers and 92 newborns, many from causes we know how to prevent. And really allow me to acknowledge the presentations that have been made here before, the success stories that we have had, the issue of sickle cell. I'm sure when you saw the presentation from Jaramogi, TRH, you saw that there were 3 red places. There was the Nyanza and Western region, which I'm told is the malaria-prone region. Then there was a coastal area, but there was an island in the middle. That island is unfortunately Nairobi, but I'm glad to report that we're making strides. We set up our screening and treatment center at Kianda 42 in Kibra. We are screening in Mathare North now and at Ruta. And just for awareness for the mothers and parents out there, I know our CHPs are able to direct people. It is good for them to know that we also have those services in Nairobi. But back to issues of every woman, every newborn, everywhere. I want to speak about how we will change these numbers that we've been told and give some examples from the capital city. Ultimately, our interventions on every woman, every newborn, everywhere will succeed, of course, county by county, facility by facility, household by household. The Ministry of Health, of course, leads with policy, but pregnancy happens in our communities, not at the ministry, hopefully. Antenatal care happens in our facilities. Deliveries happen in our maternity units. Emergencies arrive at our hospitals. And that is exactly where counties become central to the success of these initiatives. And I'm really glad, even yesterday, the President acknowledged the strong partnership between the ministry, the national government, and the county governments in addressing this. There are 3 delays that we must confront for us to sort this out. The first delay is in deciding to seek care. Then there's a delay in reaching care and the delay in receiving care once a mother arrives. In Nairobi, we have structured our response around these 3 delays. The first delay we close is taking health care to the household. The first battle is won or lost before a mother even reaches a hospital. Nairobi has 7,820 community health promoters who I'm very proud of, working across our city. These CHPs are the closest link to our mothers. They promote early antenatal care, follow up pregnant women, identify danger signs, and connect families to health facilities. Before, we used to tell people to go to hospital. These days, we take the hospital to the people through our CHPs, the strongest cog in the wheel of universal health care in our country. And we must appreciate the community health promoters. I'm glad that now we have gotten cover, shark cover, for all our CHPs. And we thank the President. I'm glad all counties have now gotten on board. I signed the check in State House. It was a big check to pay for 6 months, and Duale is paying for 6 months, and plus the issues of the stipend. And thank you for the kits. And we're waiting for the 90 days. Now it is 89 days for what they're supposed to get. The second delay we must close, Your Excellency, our First Lady, is making sure a mother can reach care. Identifying the emergency is not enough. A mother must be able to reach there when she needs it. Nairobi County operates a toll-free number, 1508, that dispatches ambulances and coordinates referrals. And just the other day, we launched with the President 922 for the National Dispatch Center in collaboration with the ministry. in the last 4 months, our system has handled 4,573 emergency alerts and referrals, about 38 a day. We are achieving a 98% response rate, and this is critical for every woman, every newborn, everywhere. 54.6%